My health story is for girls and women with special needs.
My health story is for the advocacy group.
My health story is for people with disabilities.
My health story for researchers and anyone who wants to know more about me.
And my health story is for advocacy groups.
My health story is for anyone who can relate.
Now, I would like to advocate for people with disabilities by being involved in a research project.
Dealing with my back issues has been more challenging. I have two bulging discs and walking to stay healthy has been very hard. I'm already gone through 2 back surgeries.
I wish others understand more about my muscle disorder because it's not well known. When I go to explain it, it is hard for doctors to understand unless they are a neurologist. I think doctors need to be educated more on my condition, that more research should be done.
I do not currently have diabetes, but I have a family history of diabetes. So I work hard to prevent this.
I am wondering about my condition, cerebral palsy. I want to know more about such as what causes it. I hope to be a part of the research team focusing on cerebral palsy.
Mental health and obesity are my two biggest health issues. They actually go hand in hand. Obesity can affect somebody's body image, which in turn can affect their mental well-being. I'm unhappy with my body. Obesity is my enemy as well as anxiety. For me, obesity increases my anxiety.
Because I have chronic pain and chronic fatigue, going to the doctor is very exhausting. There are some ways you could help me save energy and time. I would like to keep telehealth services after the pandemic. This would be very helpful so that I don't have to travel so far.
My goal is to become a DSP, direct support professional, because I feel that people who cannot speak for themselves need a voice, a way to be heard. They need some way to communicate with other people other than using speech, whether it's talk to text or other forms of communication.
I hope to get a job when I'm done with school. I love working outside. I would enjoy working with a landscaper. I can see myself trimming, planting trees, mowing, and gardening.
Out of all of my sports, I do stand-up paddleboarding the most. I practice 3 or 4 times a week and compete all over Florida about 10 times a year.
Things I do to keep my body healthy are I always drink 4 or 5 bottles of water a day. My drinks are thick and I eat lots of veggies and walk, exercise daily. Some things I do to keep my mind healthy or I am like to read on my iPad and watch Discovery TV and learn many.
This has affected me to the point that I can't play basketball anymore.
Sometimes I have anxiety. It's just not fun to have, but I'm still healthy. I practice breathing exercises for my anxiety when I feel overwhelmed.
I want to say I wish people would understand there are different levels of cerebral palsy and not too many people with CP are all the same. Please don't judge me for the person in a wheelchair, but judge me for the person who I am.
Since people with disabilities are more likely to be lonely, it would be a big deal to health of the people with disabilities if we could help solve this issue.
Doctors and friends to know, communicate and tell them mine. And do I can use sign and dynamics, and I do understand.
I decided that I wanted to set a goal to really challenge myself, so I will be crossing the Atlantic Ocean next year. I have a friend named Hannah who lives with cystic fibrosis every day. I am training to join a crossing for cystic fibrosis to honor her, and paddleboard from the Bahamas to Lake Worth, Florida.
To help me with my job, I would need a supervisor that can help me learn my job tasks by showing me what to do until I have it memorized. It would be helpful for me if I was able to learn one new skill at a time.
Missing the things that I enjoy doing can be really hard.
Because of my Crohn's disease, I get infusions to help prevent me from getting cancer. The result of me getting the treatments, I get tired and sometimes I can't walk long distances.
When I go to the Capitol, I want to tell the governor that they need to find a better form of communication for people who are hearing impaired to communicate with law enforcement and other people with communication barriers.
I want to encourage people to be active when you can. You have to go out and be active instead of sitting around, and that's how I stay healthy.
I'm also hoping that I will inspire other athletes like me, especially girls and women with special needs, to get out on the water and reach for their goals.
I am an artist and I am a very visual person. When people ask me to describe my pain in words like dull or sharp or achy, I don't know how to answer those questions. I like this artist pain skill because it is more meaningful to me. It literally shows if a person is in agony versus if a person is content.
For about a year and a half, I was on a walker in a wheelchair.
I believe this data would help people like me who have had the same issues with anxiety. I believe using technology makes sense since most people, including those with disabilities, have cell phones and know how to access apps. That also means there would be no extra costs, which could be a barrier for people with disabilities. Furthermore, since the research is gathered in your home, there's no need for transportation, which can also be a big barrier for people with disabilities.
I want to prove to myself that I can set a goal and complete it, and also I want to show Hannah how much she means to me.
I want to say that I wish doctors would speak slower and clearer when having a conversation with me. I also ask them to talk directly to me and not just my family members because I'm capable of having a conversation.
I don't always feel like the doctor listens. He is supposed to be listening to the patient and the needs that the patient is going through.
It can be hard for me because I go into it with negative past experiences. A lot of the times I go to appointments with my mom so that she can help answer for me when it is hard for me. However, I feel really disrespected when the doctors talk directly to my mom because I am the patient. Sometimes it seems like they think I am not even there. I am hoping you can prove me wrong. I think that if all current and future doctors would follow these suggestions, healthcare would be better for everyone.
My mom and I were in a situation where some strangers thought my mom and I had parked in the handicapped parking spot just to park closer to the door of the store for a shorter walk. This situation almost caused a confrontation because my mom felt she didn't have to explain to a stranger who had no authority why we parked in the handicapped parking spot.
One thing I am worried about is getting diabetes in my future. I try to use healthy eating and meal plans to prevent diabetes.
Competing in Special Olympics allowed me to stay fit, but I've reached the age where I can no longer compete, and I'm struggling with my weight because I am not competing. I'm also worried about diabetes because of my family history and my risk factors. I was diagnosed pre-diabetic a few years ago and was able to get rid of it, but the fear still looms over me, as well as other obesity-related issues such as heart disease. Obesity often is is often a health condition that's not talked about by doctors to people with intellectual disabilities. Risk factors such as diabetes and heart disease are often caught too late. If doctors were focused on preventing obesity for people with intellectual disabilities, many health issues could be prevented.
I learned that one of the medicines I was taking earlier for seizures also helped my muscle disorder. When I learned this, I went back to my doctor and asked to be put back on the medicine because it was on the list of medicine that would work for my muscle disorder. After about 4 months taking it, I was back walking. This is something I was very proud of.
There are different levels of cognitive disabilities as well as different levels of autism. We are not a label, we are people. We are not a certain group of people either. The most wonderful people are those who do not fit in boxes. People need to understand that disabilities are only a portion of who we are. They need to take the time to get to know people like us so that we can expand and be inclusive in things that quote unquote normal people do in day-to-day life.
We need to learn that in certain situations, even if we feel like we shouldn't have to share or disclose our disability, sometimes we should just be humble and share our disability with people to avoid conflict. Because we must explain to people who don't understand that disabilities are not always visible. So we must be an advocate for people with a disability. We must explain to people in the mainstream world that there are people with visible disabilities and invisible disabilities.
Once I know how to do something I'm really good at, it makes me proud to work hard.
I am proud that I am keeping myself very active each morning. I am also proud that I can eat correctly, and I am really proud of having time to talk to friends.
I am also proud of the fact that I'm part of the Athlete Leadership Program, where I get to advocate for Special Olympics along with other responsibilities. I have been part of this program for 10 years.
Being hired by a landscaper company would make me feel proud. I would be excited to meet new people at my job and to make some new friends who also like to work outdoors. Maybe someday I would even use the money I earn at a job to buy a house and to pay my own bills.
Even though people with intellectual disability may have challenges, this shows that we can still live our lives in a healthy way.
Another thing that I am proud of is even though I have a disability, I still went to college.
By hiring me to work at your company, it would not be only be hiring a hard worker, you would also help me work towards my goal of being a landscaper.
I was born a happy baby with Down syndrome. Usually babies cry when they are born, but I didn't cry like a normal baby. Down syndrome babies don't cry until later. This makes me a very special baby because I am.
Special Olympics is important to me and people like me because it gives us opportunities to show people that there's more to people like us than just our disabilities. We're able to show our potential and what we're capable of doing, as well as some of our weaknesses.
That as long as I live with faith, love, dignity, and respect, I'm a true winner. Because I'm trying to my best of my ability to represent and be an activist for myself and all my friends in Special Olympics.
Doctors should work to be inclusive, to let us participate in our own health care.
So be the star you were born to be. Big, dig deep, shine bright, and love yourself always. I believe in me, and I believe in you.
Lastly, I should smile at, and you should too.